All right, so just to summarize the findings and implications, I feel that we've shown, just using a kind of a theoretical model, that modest and achievable levels of treatment could be used as primary prevention of hepatitis C in the injecting drug user population, despite the potential risk of reinfection after successful treatment. Okay, as such, treatment could play a significant role in prevention of hepatitis C alongside the other currently used prevention measures. I really feel that the value of mathematical modeling is that sometimes you come up with results that are surprising and they're counterintuitive, and results which can change people's perception of the situation, hopefully like some of the results that I've shown you today, okay? And as such, modeling can be used to generate hypotheses and to predict outcomes and to set targets for clinical trials and studies that are done in the future. Of course, these are just models, and the projections that I've made today are approximations, and they're limited by a lack of available data on treatment and active injecting drug users, as you've already heard today. So the parameter values just aren't known as far as, treatment compliance and uptake, and those things really need to be addressed in the future. So some of the key limitations of this work is that we did not include heterogeneity in our model. And we know that heterogeneity exists. There's heterogeneity in risk, there's heterogeneity in treatment accessibility, and that heterogeneity exists across an individual's injecting career. So for example, we know that there's an extremely high risk of acquiring the disease in the first year of an injecting career, or periods that related to homelessness and times in prison are often related to increased risk. However, for example, times in prison, it may be a perfect opportunity to actually initiate treatment. And we also know that there's heterogeneity across the injecting drug user population, so high and low risk injectors, and that heterogeneity is going to affect the projections that we've made and the efficacy of this as a prevention intervention. So I know that there are settings where active injecting drug users are being treated. There are pioneers here today who are doing that. But the key question is whether injecting drug users who are at high risk of transmission can be successfully treated, and if we can actually see a result in the prevalence within the IDU community. So what we need are more clinical studies that are actually treating active IDUs, that are seeing if we can actually access and get in the high-risk IDUs and treat them successfully, and if we can measure if we can measure prevalence reductions within this community. So I just want to reiterate that I really would like everyone, I hope that people can start think about using antiviral treatment as a way of treating hepatitis C as an infectious disease, not just a chronic disease. Thank you.